Hey everyone, welcome to another edition of Get to Know Gives Back. I'm your host, Quinn Pettifer, Manager of Brand Initiatives for the Gazette. And in that role, I get to do a lot of things throughout the year with our nonprofit community. The Gazette Gives Back program is a chance for us to support roughly 31 nonprofits throughout Eastern Iowa that have incredible missions, provide very impactful services for literally thousands of people each and every day. One of those organizations, of course, is the Eastern Iowa Health Center. And with me today is Joe Locke, their president and CEO. Good morning, Joe.
Good morning, Quinn. Thanks for having me.
Absolutely. Thank you. Joe, we were just talking a little off air here about your time with Eastern Iowa Health Center. I feel like it's just flown, but you've been with this organization now for over 10 years. Is that correct?
That is correct. Yeah, 10 years in January, and we've had a lot of interesting growth. 10 years ago, we had 18 employees, and we provided family medicine, which is a service just like when you go to the doctor. So we've had a little bit of growth since then. So as of today, we don't have 18 employees anymore. We have 140, and we provide family medicine, pediatrics, OBGYN, including delivering about 700 babies a year locally, dental services, and behavioral health. And we're getting ready to open 3 new services this calendar year as well, which I'm eager to talk about.
That is incredible. I know you've worked with several of our nonprofits within the Gazette Gives Back program. I don't think there's been a nonprofit that I've met with, spoken with, interviewed that hasn't made some sort of reference to Eastern Iowa Health Center. You really do. You and your team have so many important collaborations and partnerships. I know a lot of referrals come your way when clients are in need of things outside of a nonprofit scope. You're usually there to be able to help them make those full service needs filled. Tell me a little bit about just the overall mission. The organization has grown over the years, but what at the heart of this organization are you trying to provide for Eastern Iowa?
Our mission is very simple, but it's very powerful, Quinn. Our mission is 4 words: exceptional healthcare for all. And what that means is that it's not exceptional healthcare for people with great insurance,
Mhm.
right? We certainly do take in patients from all walks of life for those that have insurance. But if the hallmark of what is known as a federally qualified health center is that if you can't afford to pay for your services, we treat you anyway. We write grants. We rely on personal and corporate philanthropy to help meet our mission. And what that means is we don't turn anybody away, period. Let's say that that a patient works 3 jobs and they don't earn enough hours to be benefits eligible. In other words, they're not allowed to work enough hours to be benefits eligible at either one of those 3 jobs. Then we will see them. If they can pay us what we call our sliding fee scale, then that's great. It may be a $300 service that they may pay $8 or $12 for. And if they can't afford that $8 or $12, then we'll see them anyway. So the way we count one at EIHC is when a provider sees a patient. So think doctor, dentist, therapist, pediatrician. So the way we count one is when we achieve a billable encounter, okay? Provider sees a patient. So 2 years ago, in 2023 calendar, we saw 47,000 patient visits or encounters. This year, we're on track to see 71,000 patient visits. And that's before we open a new pharmacy and a new urgent care and a new vision center. All of those 3 things are going to happen in the next 6 months on our campus at 12th Street Southeast and 4th Avenue Southeast.
That is incredible. I know obviously your staff has grown over the years. How about volunteers, board members, volunteers? It takes a village to put together this kind of service for this many people. How has that grown over the last few years?
So I just want to start by expressing gratitude to my incredible board of directors. They have ensured that we stay on the straight and narrow, that we have a long-term path to financial sustainability, which is so important in every business, but certainly in a nonprofit. As I like to say, a nonprofit is a tax status, it's not a way of life. We've got to make a little money to keep to keep growing and to keep programs open, but mainly to stay focused. I mean, if we don't start an initiative, when we start a new initiative, we look through that patient lens. And if it's not something that is benefiting our patients, then we just don't do it.
Mhm.
And so the most logical thing for us to do, and this has been, I mean, the Hy-Vee closure a year ago on June 26th was a tragedy for Cedar Rapids, specifically for the Wellington Heights and Mountain View neighborhoods. And so we had actually started to plan to work toward to start our own in-house pharmacy starting in January of 2022. And so it's taken a lot of work and a lot of time. We actually spent $60,000 on a needs assessment. And of course, the outcome of the needs assessment from this national firm was it either made you want to cry or grab your checkbook or both, because there's such a need. 7 out of 10 of our patients earn 100% of the federal poverty level or less. 7 out of 10 patients. So that's $32,150 for a family of 4 people. That's 7 out of 10 patients that walk through our door. And yet we see professionals from all over town as well. We had 46 languages spoken under our clinic roofs last year. The second of which, after English, was not Spanish, it was Swahili, and then Spanish, and then African French, and then Kirundi, and then Haitian Creole, and it goes on and on. So we're on track this year and so interpretation is a big part of our business.
Mhm.
And in other words, making sure that people really understand the medical and dental and other services that they receive in their first language. And so the way that works is we have a Cadillac product that we use where it's an iPad as big as a person's face. So literally you're having interaction with a person somewhere in the world that is fluent in their own language and then fluent in English. And those machines articulate, and we can move them down in front of a patient, whether they're in a wheelchair, or move them up where they're on an exam table, or even slide them down to where that patient lying in a dental chair is able to have those interpretation services as well.
Wow.
And so it's something that we're really proud of. It's also really expensive, and that comes out of our own pocket. It's a Cadillac product. Like I said, we get charged $1 a minute. So when 3 years ago, our costs got to be $200,000 just for interpretation, 1 minute, $1, 1 minute at a time. We thought that was pretty significant. This year, we are on track to spend more than $500,000 just on interpretation services. We consider it a real privilege to treat everyone that comes in our door, no matter where they're from, no matter what language they speak, and that we are able to provide those services in a very culturally competent manner that makes that patient base comfortable. The other thing that we've really focused on in the last decade is premium facilities. When we treat a patient, they're a human being that deserves dignity and respect. We have excellent facilities for when you go to the doctor, when you go to the dentist. We were able to go, we built a new $5.6 million dental clinic and opened it up a year ago, November. And we were able to staff from 14 staff to 36 staff in fewer than 90 days, because who doesn't want to work in a state-of-the-art facility with brand new equipment? And by the way, so 2 years ago, just in dental alone, we saw just north of 10,000 visits. We're on the way right now in this calendar year to see 26,000 visits just in the dental building alone.
I know Gazette, we've talked to you about that from a coverage standpoint. So many people don't understand the full scope of need when it comes to dental care, whether it's Iowa, Eastern Iowa, or throughout the country. That is such a huge win for our community and your clients.
Well, and the thing is that the doctors are special people, but doctors aren't dentists. And so if you go to the emergency room, the doctor can't help you. They refer them back to us. And so, and it's the same thing with pharmacy. If you're making that, one of those 7 out of 10 patients that we serve that are earning $32,000 a year for a family of four, you're literally having many days the crisis du jour. It's food insecurity, clothing insecurity, housing insecurity. And if you have to make a decision whether or not to buy diapers or put food on the table or pick up your prescription, we want to alleviate that problem. And that's why we're starting a new pharmacy. In fact, we're going to start a soft opening on June 2nd. And doesn't it just make sense that if you had a pharmacy, that you also ought to put an urgent care in it? So you could come and be seen by a provider, get your health needs taken care of, have that prescription filled in the lobby of the same place that you're sitting for that provider, for that medical visit.
What a convenience for when it comes to travel needs too. I mean, rather than having to go back and forth and figure out transportation for those that might have some challenges with that. That's amazing.
And so really the idea is not only to help, just like that new grocery store that's going to open in Wellington Heights this summer, that because of the pharmacy desert that was created when right there on First Avenue, which is about 4 blocks from us. So when we open to the public, which will probably be midsummer, maybe even August. So we're going to start out and walk before we run, right? And we'll do a grand opening. It'll be a big splash. But the idea is that we want to encourage people to switch their prescriptions to our pharmacy and keep that money local. And so the reality of the situation is that we want to be able to. Well, let me just say it out loud. So if I'm a CVS customer, it's really convenient. I can drive through on my way home from the office, zip through that drive-through, and that money goes to Rhode Island. If you go to Walgreens, any profits, they go to Illinois. If you go to Walmart, that money goes to Bentonville, Arkansas. We want to keep those dollars. We want to ask the public to transfer your prescriptions to Eastern Iowa Health Center so that we can turn around for those patients that can't afford their prescriptions and make it affordable for them. And so the way that it works in general is the hardest part about starting a pharmacy is year one, because it's really behavior modification. So it's me learning not to stop at CVS. And by the way, it's against the law in Iowa. If I called CVS and said, hi, this is Joe, please transfer all of my prescriptions to Eastern Iowa Health Center, and they can't say no.
Mhm.
I mean, that's just, you can't say no. The other thing to say out loud, Quinn, is that, any kind of prescription drug coverage that anybody has, whether it's Medicare, Medicaid, Blue Cross Blue Shield, Aetna, Humana, commercial insurance, et cetera, that's a contract between you and your insurance company. And so what that means is your $5 copay is going to be $5, whether or not you choose Eastern Iowa Health Center pharmacy or CVS, Walgreens, Walmart, et cetera. And so you're going to pay the same for the exact same pharmaceutical. So why not leave that money here locally where we can turn around as a nonprofit and benefit those that need that service and need that medication? And we'll literally be improving overall population health because our docs are going to know that the patient's going to pick up that prescription before they leave our campus.
That is literally a way that, I mean, in terms of, I always end these segments with how can the community be supporting you, be a part of solutions for your work. Obviously, a call to action come summer is to really think about making that move to the new pharmacy and to be supporting local and be supporting the incredible work of Eastern Iowa Health Center. Joe, if somebody is in need of services, what's the best way to contact and reach out?
So 319-730-7300 is our phone number. You can also go to easterniowahealthcenter.com, which is a really long URL, but it's fairly straightforward, easterniowahealthcenter.com. And you can make an appointment, you can schedule online, you can call us, and we will get you in quickly and efficiently. And I will put our docs and our providers and our dentists and our therapists up against anybody in the community. I mean, we don't utilize volunteers for medical professionals and dental professionals. We pay market rate, and so the 700 babies that we'll deliver this year, and the 26,000 dental visits, and the 6,000 pediatric visits. I mean, all those things add up, and we're here to try to make a difference and improve the lives of Cedar Rapids every day.
For everybody, for everyone with
For
dignity
everybody.
and respect. And Joe, I also just want to say thank you. You have personally been a go-to source for us when it comes to various healthcare content and stories and coverage. You've also helped us in an advisory council level for our Iowa Ideas Conference within the healthcare track. Certainly your organization is champions, are champions when it comes to this work. I know you individually have really gone above and beyond being that advocate to make sure that every single person receives the services that they deserve. So thank you for that. We're really, really proud to get to work with you, especially within Gazette Gives Back. So thank you.
Absolutely, because the Gazette gives back every day and providing that local journalism, and that's an important thing.
Excellent. Thank you so much, Joe. And thanks to our viewers for checking out another edition of Get to Know Gives Back. We want to give a shout out to, of course, our presenting sponsor, Collins Community Credit Union. They make this podcast and the program possible. I'm Quinn Pettifer. We'll see you next time.